When we talk about ethics and ethical decision-making, it's important to start at the beginning. We need to ask, what is ethics? Maybe not surprisingly, there is a disagreement about how to answer this question. However, there are a few elements common to most ethical theories. This presentation summarizes 4 common elements presented by Devettere in the classic text Practical Decision-Making in Healthcare Ethics. First, ethics is about choices that are intentional and on purpose. This is in contrast to things that happen accidentally or unintentionally, even if those things result in something bad. An example given by Devettere is if you accidentally step on someone's foot while getting on a crowded elevator, this is not an ethical matter because you did not choose to do it. You did not do it intentionally. However, if you stepped on someone's foot while pushing and shoving your way into the same crowded elevator, there is some ethical responsibility because your choice of how you got into the elevator, your intentional behavior, increased the risk that you would step on someone's foot. Another consideration is that choice includes what we choose to do as well as what we choose not to do. When we could act but choose not to act, we are making just as much a choice as if we chose to act. Choosing what color to paint your house is not an ethical choice because it doesn't influence the world in terms of good or bad. Choices are only ethically significant when they impact the world in a good or bad way. Thus, ethics is also about evaluation, which is the second element of ethical decision-making. When discussing ethics, we discuss judgments about values. We differentiate between the good and the bad. Determining between good and bad can be clear-cut. For example, we help our elderly parents. We do not exploit them financially. However, sometimes determining between good and bad is much more complex. One only needs to think about controversial topics such as withdrawing life-sustaining medical treatments, when a choice results in ending a life, but also ending pain and suffering, to know that choices are not always clear-cut. Many choices include both good and bad elements and thus need to be evaluated. In order to evaluate if decisions and actions are good or bad, there needs to be a standard of evaluation. When we make an evaluative judgment about good and bad, we employ a criterion or norm. Thus, the third element of ethical decision-making is that it's normative. Ethics is about more than someone's belief that something is good or something is bad. Ethics is when we dig into why someone thinks something is good or something is bad. When someone says that they think something is good or bad, that person is appealing to norms. These norms could include God's law, natural law, Kant's duty of justice, or the utilitarian concept of the greatest good for the greatest number of people. Ethicists disagree on what should serve as the normative basis for ethical and moral judgment, but they don't disagree on the need for something to serve as the normative basis for ethical and moral judgment. This determination is where much of the work of ethics resides. Commonly, we rely on ethical wisdom to provide our normative basis. However, sometimes we aren't able to rely on ethical wisdom because traditions can misguide us, such as when it was normative for people to own other people as slaves. Additionally, especially in healthcare, the ever-changing advances in technology means that our predecessors did not experience what we are facing today. Thus, the fourth element of ethical decision-making is that we have to work to think and reason about what is ethically good and what is ethically bad. This can be difficult because what seems good can actually be bad, and what seems bad can actually be good. Common examples are a bag of chips seeming good, but actually being bad for someone with a sodium restriction, or fasting when you're really hungry seeming bad, but actually being good when you're having surgery in the morning. Additionally, good things and bad things are often mixed. Think about surgery. It's often necessary and even life-saving, but it comes with pain and many risks, such as infection. Another difficulty in discerning between good and bad is that we are distorted by psychological and social biases beyond our control. Our viewpoint is only one viewpoint, and it's limited by our particular history, social, cultural, and religious contexts and experiences. There are 3 levels where reasoning happens. The first is the personal level and includes decisions that I am personally affected by. I decide what is good. I actually do what I decide is good. I am affected by what I decide. An example is deciding to be full code or do not resuscitate. The second level of reasoning is judgmental. These decisions are when I myself consider a particular situation and want to know what the good decision is, but I do not actually do the decision. I'm not directly affected by what I decide. An example is being the adult child of a patient deciding whether to be full code or do not resuscitate. The third level, theoretical, is when we study what others have written and said about ethics. This includes things like studying biomedical ethics or ethics based on divine law. So in summary, when we ask, what is ethics? Although not an exhaustive definition, we now understand that ethics includes 4 elements. First, ethics is about choices. Second, ethics is about evaluation. Third, ethics is normative. And finally, ethics includes reasoning.